The previous video was on vaginal yeast infection, the overview of vaginal yeast infection, the causes, signs and symptoms, risk factors, preventive measures, and the treatment. So today I'll be focusing on recurrent vaginal yeast infection. When you say you're having a recurrent vaginal yeast infection, that means you're having an episode of yeast infection for at least 3 times in a year. And according to some studies, about 5% of women get this recurrent vaginal yeast infection in a year. Remember, this yeast infection is caused by a fungus, Candida albicans. Although they are normal commensals in the vagina, but when there's an imbalance of the healthy bacteria in the vagina, the lactobacillus, this Candida albicans will overgrow and cause this yeast infection. What are the reasons for this recurrent yeast infection? Number 1, incomplete treatment of the initial yeast infection. You didn't treat it very well, so it will still reoccur. 2, sexual activities. Though it is not a sexually transmitted infection, but when you have multiple sex partners, it can predispose you to this infection. Next is drug resistance. You've been treating it with a particular type of antifungal. They are now resistant to that particular antifungal. So once you take it, it won't treat the infection to still surface. Then moist and humidity. These Candida albicans thrive very well in a wet environment. So when the environment, the vagina is moist, it favors this growth. So let's discuss the treatment plan for this vaginal yeast infection. You need to pay attention because the treatment for this is different from the treatment of normal yeast infection. This recurrent yeast infection needs a longer duration to be treated. And since it's a fungal infection, an antifungal is the best choice of drug in the treatment. And this antifungal comes in pessaries, creams, or tablets. So I'll be discussing the vaginal pessaries, that is the insertions, and the tablets. Coming to the orals, that the tablets, fluconazole is the drug of choice in the treatment of this recurrent yeast infection. As a single dose, you will take 150 mg. Then subsequent times, you will now take 150 mg, 3 days interval for 3 doses. Let me explain. After the initial 150 as a single dose, you will now take extra 3 doses. Let's say that you are taking 150 mg today. Let's say today is Monday. You took 150 mg. Tuesday, Wednesday, Thursday, you take another 150 mg, making it 2 doses. Friday, Saturday, Sunday, you take another 150 mg, completing the 3 doses. The 150 mg must be for 3 doses after the initial 150 mg. Then after that, you will not be taking 150 mg every week for 6 months. Once you come this week, you just take 150 mg. You can either choose Monday, Tuesday, Wednesday, or Thursday, but make sure that you take 150 mg every week. The next week, 150 mg. Continue that for 6 months. That will just treat the infection. Coming to the pessaries, that is the vaginal inserts. Clotrimazole is the best for the treatment. 500 mg as a single dose per night. At night, you just insert 500 mg of this clotrimazole. Then you still insert the 500 mg at night for 7 to 14 days after the initial dose of the 500 mg per night. Then once you are done with it, you now continue with 500 mg per week for 6 months. But if you are pregnant, this starting pessary is best for 100,000 units for 12 to 14 days. After the 12 to 14 days, you now start another 100,000 units, 14 nights per month. That means that in every month, you must make sure that you will insert for 14 good times in a month for 6 months. That means, let's say this is August. In August, you insert 14 times. September, 14 times. Do it for the course of 6 months. You know that pregnancy is one of the risk factors of this candidiasis. So treat it accordingly in order to avoid any complication. The complications: number one, painful sore as it's itching you, you're scratching it. So it will lead to that. The next point is systemic candidiasis. It has entered the bloodstream. Then infertility. Although it is not a direct complication, it affects it indirectly because that time the pH of the vagina is no longer favorable. It's no longer balanced. So at times it may not really favor the sperm there. They are directly to infertility. So adhere to the treatment regimen in order not for it to recur again, because this recurrent vaginal yeast infection is not really good. The kind of discomfort that comes with it is nothing to write home about. Treat it properly to avoid recurrence. Have a nice day.